Welcome everyone, this is Patricia from the International Hospital Federation. Thank you for joining us in our webinar today, Innovation Strategies for Hospitals, Getting the Right Innovations in and Spreading Your Own Worldwide. This webinar is being presented by Marcus Dawe and Dr. Mathew McGann, co-founders of Health Horizon. Marcus Dawe is an expert in health innovation at a global scale. His focus on hospitals comes from his position on the board of the group that commercializes new solutions and process improvements in public hospital and health services across 5 states of Australia. Now with Health Horizon, he's bridging his decades of experience in data and internet services to provide an online global platform for finding and distributing health innovations worldwide. He has expertise in innovation strategy, data modeling, health data systems architecture, and health systems consulting. In his more on-the-ground roles, Marcus single-handedly developed a chronic disease register for the state's health department. He began his story as a data expert, pioneering use of the internet in Australia in the 90s. Mathew McGann is the co-founder and product manager of Health Horizon, a platform for professionals and the public to find and track the health innovations under development that matter to them. He managed large university industry projects through the Australian National University after completing his physics PhD and ran multiple innovation and entrepreneurial competition and educational sessions for the university. Now he's combining his knowledge of institutional collaboration and data systems to help healthcare institutes with problems to find the solutions they need. Marcus and Mathew, thank you very much for joining us today, and I'm now handing over the webinar to you.
Thank you, Patricia. I'll speak first, so I'll just move the camera here. We've come across this opportunity after the World Hospital Congress in Brisbane last month. We held the Innovation Alley there, and the opportunity came by to give a presentation on innovation because we have quite a global perspective on what hospitals and other innovative institutes and universities are doing around the world in terms of health innovation. So if we met you at that Congress, nice to see you again. And if you are new, it's nice to meet you. We wanted to begin with a picture of how things used to be. Hospitals have always been innovating, and in the past, it's mainly occurred through clinicians. You know, the people who do healthcare care about people. They want to improve how they deliver their healthcare. And so when they thought up new things, they would share them around and try and integrate them into their practice, into the hospital at large, and the system progressed like that. So seen from the perspective of a hospital, you could call that sort of an ad hoc discovery. And then when a hospital knew what it wanted, it could do, say, a tender-led procurement. But otherwise, it was bottom-up clinician practice-led innovation that hospitals did. Now that hasn't really changed, but the number of challenges that are faced has increased exponentially. And so it's become more and more important for this bottom-up innovation to be encouraged and supported with top-down support and strategic guidance. So that's a move toward more active strategic searching, strategic methods of procurement, executive level support and vision and leadership. The challenge is that there are too many challenges to leave this kind of thing to chance. But the good news is that in today's globalized world, it means that every hospital, any hospital, can benefit from the world's best solutions. It's a matter of transparency. How do we know what's been solved out there, and how do we get access to it? This is what we'll talk about. We'll give some of our tips on how to do this. Before I begin, I thought I'd just say something about Health Horizon. We're a relatively young company, 4 to 5 years old. So I'd like to just explain what we do and how we know the things we do. This started when Marcus worked for a group that commercializes public health innovations across multiple states in Australia. And they had a portfolio of, I think, 500 innovations, service improvements, things that can help people. And that's just so much stuff to get out there. But there was no channel, there's no way to get it to market. And there's no way to make it visible, and there was no clear pathway for each of these. So with this problem in mind, we started a research project, and out of that came Health Horizon, which we founded and began tracking the world's health innovations in 2014. And since then, now we provide services to hospitals and institutes to improve their innovation, their global visibility of what can help them. We improve how they can promote the work that they do globally, and we provide analytics at the national level to help support the entire ecosystem. And it's all available now. I suggest you check it out, thehealthhorizon.com. You can just search and start following the world's health innovations. The platform, the public platform at thehealthhorizon.com is a place where we detect and track the progress of every health innovation in the world. So here are just some examples. We define health to be quite broad. It's anything that a consumer, I suppose, would think health is, but it goes from therapeutics and devices all the way into pathways, health services, this kind of thing. Behind the public access that you can see is a much larger data set, highly connected global data set, where we're tracking 4,000 innovations around the world, millions of data points, millions of points of connectivity that connect the companies that do certain solutions, what evidence they have, the funding that's behind them, the regulatory milestones they achieve. And the goal of all this data is so we can present it so that everyone in the world can know what's out there and benefit from it. Now, before we move into the specific tips, I just wanted to explain the perspective we're coming from. We have a global data set. Marcus has experience on the ground at the same time. This is going out to hospitals around the world with totally different health systems. So this will be a very high level strategic perspective, but that's good because one of the major things we'll talk about is that high level strategic perspective of the hospital. One step before we talk about it, I think it's important to reframe some of the ideas that might be in your head about innovation. The first is I challenge you to expand what you might define as an innovation. 40 years ago, it was very much that things were either a new device or a new drug. And that's reflected in the fact that the paths to market are very clear for these two things. Governments are very comfortable with these two things. And that's how the system works so far. But in 2018, and certainly in the future, this has exploded in the kind of things that actually classify as innovations and things that can help people. So it includes models of care, quality improvements, pathways, campaigns, consumer-led healthcare, and then the entire sector of digital health at the same time. So while you're expanding your definition of what constitutes an innovation, I'd also encourage you to consolidate how you think innovation is done, because in history, certain words have evolved to describe certain aspects of it. You can take it a commercialization point of view. You can think about licensing. You can think of it as an entrepreneur inside the organization. You can think of it as research or practice translation. But bundle those up into a single concept. All these people are doing innovation, and they just need your support to help them do it. We're going to talk about 6 tips, which we've divided into 3 tips about how to get innovations into your hospital and 3 tips about spreading your innovation out into the wider world. Above all of this, it's critical that you have an executive level support and initiative, because it's really the only way that the groups below have the permission to act on these tips and make the hospital a more innovative place. Then the other overriding thought here is that these technology solutions have a focus on their value and their impact to hospitals. So always do keep that in mind as well. So with that, I'll pass it over to Marcus to talk about some of the specific tips.
Thanks, Matt. So there's two sides to this innovation challenge that we all have, and that is that we're looking for innovation to bring in to our hospitals, into our institutions, and to solve problems. And then we're also looking to develop solutions internally. So just separating those two out, they still revolve around you articulating what your problems are to be solved. Innovation by itself is not a worthy activity. You really have to be encouraging innovation, to be targeting around your key problems and worthy problems to solve within your healthcare settings. So this is really key to the whole innovation movement around the world is based on this concept of solving real problems. So just on tip one, the way that typically we may have done things in the past was that we know we need something, but we start looking for a solution before we actually articulate what it is we're trying to improve or to solve. So the paradigm here is that you're asking for a solution. You go out too early, and you might go and buy a solution, and then lo and behold, it's not adopted, or that you don't get a lot of good uptake of that solution, and it's hard to fit into your culture. So a far better way to do that is to use innovative practices, and there's a whole lot of different techniques in innovation around articulating problems. You've probably heard of hackathons and things like this. It's where people bring problems, and then you bring a group of clinicians and researchers together, and they can come up with ideas about how to solve problems. But also some of the leading hospitals around the world are building models of innovation that actually allow everyone to participate and become active innovation participants. So they're building these ecosystems within the hospitals. And the Sheba Hospital in Israel is a good example, where they've actually come up with a model of innovation called ARC, which they're selling around the world as a concept and as a paradigm to other hospitals. And we've actually created a channel of some of the innovation coming out of that hospital, and it's quite fantastic how they've been able to align a lot of the interests that the clinicians have in their research and in their quality and safety agendas, and then align them with these new solutions. And whether or not they're developing them themselves, or they're able to find them through Health Horizon or through their networks, they're able to really hone in on those problems. So that would be really our suggestion for any of you in your hospital groups, is to get good at articulating the problems. So, one of the ways we kind of help you at that next stage is that once you've articulated your problem, and you think that it's a particular type of innovation. There might be a device or a therapeutic or a diagnostic or a system of care or a program. You can actually take a look and find something on Health Horizon that might suit you. And that is really important, because you can then start to do evaluation of potential solutions even before you've engaged, to see whether or not there are things that suit your problem. So at that point, tip 2 really gets down to the concept that you should think about evaluating solutions, potential solutions, or even some emerging, say, similar activities that are being done by other hospitals, rather than necessarily developing or procuring it yourself. And that's why with Health Horizon we've tried to make it easy for you to do that, to really build a hit list of solutions that you might be able to integrate, or you may even be able to just adopt straight, or even collaborate with. So just on the concept also of innovation, there's an important paradigm in innovation, and that is that you should have mechanisms for trialing and for piloting new innovation without risking a whole program or risking too much capital. And that's what an innovation approach allows you to do. So you rather use creativity and look at don't build it automatically yourself. That's a pretty important paradigm. So tip 3 is really about implementing, and I touched a little bit on this. There are a whole lot of different models that, rather than just the standard procure and implement models, there's a whole lot of new models that innovation is bringing, like risk sharing. So what you might find is that there's another hospital that's developing a similar system, or that they've developed one that you might want to take, and they've already done a whole lot of the work for you, and they're willing to, say, further develop that solution with you, and you can risk share in that development. Agile methodologies is another one, and that's come from the software world, where you quickly move towards rapidly improving a solution or an innovation towards your specific requirements. It's not something that traditionally software development and systems design have taken a long time. They use kind of standard waterfall methods. Agile methodologies means that you're moving very quickly to solving your exact problems, and you get concepts like minimal viable product, for example. So you get the minimum concept up to prove that it would work, and then you can improve on that. The other thing is that design thinking is something that's very prevalent now, and that's where you change the paradigm around how you design your innovation and solutions. And one thing that everyone would all be familiar with is patient-centric design or service design, for example. So these are new ways of thinking that can actually improve the way in which you develop a solution and involve innovation. The other one is that C-level initiatives are really important. So getting your CEO or CTO or Chief Medical Officer on board, and at multi-levels of the C-level, you should be engaging anyway, because innovation really is a culture, and if you can get C-level engagement, then it works a whole lot better, because they allow you and they give you the room to actually try new innovation and try new things in your hospitals. Now, there is a science around doing this new implementation and implementing innovation. It's called implementation science. So I'd encourage you to look at some of the leading papers and works coming out of implementation science. So that leads us to the counter side to this, and that is, once you have innovation and you've got some a therapeutic device, a diagnostic, an app, a treatment program, a new course, whatever it is, it could be from any of those sectors. It's how do you find an audience for it? How do you find people to potentially license that to create some revenue for your hospital, or just to make it available because it's such a great innovation? So this is again where it's around a culture of innovation that's required, and that's really where you have a group of people who are innovating, and you give them all the tools they need to go and test their innovations, and then ultimately they'd be wanting to put them on somewhere like Health Horizon. They'd want to be showing them at conferences and the like. And so the opportunity there is for you to create a space in your hospitals and virtually as well, in your websites and in your own channels like on Health Horizon, where you can showcase your innovation. And it's really important because you really want to try and attract things like capital. You want to attract investors potentially. You want to attract trial participants. You want to attract a whole lot of different people and groups to your innovation. And it's a pretty important concept. But this kind of starts with your hospital and your hospital group embracing the concept that there is innovation happens here. So you've really got to focus in the innovation on the benefits, and hence it's important when you're when you're getting your innovations together and you're maybe doing an audit of your innovations, an important step to see, who's doing what. That's important, that you can simplify that process as well. And we coming back to something I mentioned, and that is simplifying innovation out of hospitals can be brought down to three concepts, and that is, what is being innovated? So what is the innovation that's being developed by any of your people in your group? What does the innovation do? So they're developing something, they're developing a device, a therapeutic, diagnostic, an app, a campaign, a quality safety review, something that's an innovation. So what does it do? So you have to be able to articulate that easily, and then determine what stage is it at. So Health Horizon helps you with identifying some of these concepts, and this is kind of forms the basis of how we classify these innovations. So one important concept when you think about innovation versus, say, how medical devices and therapeutics have been developed in the past is that often a lot of these were very strongly IP bound. So patents and a lot of secrecy was formed around innovations in previous in the previous world of commercialization. Now, differently now, you find a whole lot of innovations don't necessarily have strong IP attached to them, but they could be still licensed, or they need to be moved on to spun out, or they need to be moved or sold off to an organisation that can take that innovation on and commercialise it. So, what's important is to let the world know what you're doing as soon as you can, and making a public disclosure, like through Health Horizon, is an easy way for you to provide global visibility to others who may be looking for what you're providing, what problems you're solving. So, but also internally within your own organisations, and some of you may be from very large organisations, it's important to be able to showcase those innovations you're doing, because it also then helps the whole organisation understand how much innovation you're actually doing yourselves. And that's an important concept, because it adds to the culture that your hospitals see themselves as being innovative, that your clinicians and your administrative staff all wrangle behind the concept that you are an innovating group. And so promoting those internally and externally are very, very important. So I'm going to hand over to Matt now, and
thank you. We just wanted to, after going through those tips, tell you about a group we've been talking to who are really at the cutting edge of all of this. And this is Sheba Hospital in Israel. They have a system that they call the ARC model, and it is best described as how it's laid out physically in a hospital. Picture a new building. The bottom floor of that is what they call the idea lab. This is a place where groups, clinicians, nurses, whoever in the hospital has an idea, something that they think could solve the problems of others, can come, show their idea, and start developing it. The second floor is the startup hub. Sheba, under this ARC model, opens up to local startups and says, you have a lot of great ideas, and we have the resources you need. We have the patients you need, we have the clinicians you need, your end consumers, we have them here. We've got technology, we've got expertise, we have knowledge. So they get brought into the startup hub and they can develop their innovation within the system. That is tied to some grant money, usually for these startups, and that's provided by strategic partners. So these are large industry groups. We're talking like the Googles of the world, the Microsofts, who provide funds to this model, and that money goes to these startups to bring in fresh ideas, and then those ideas benefit. So this idea of a startup hub is kind of like, it's setting up the hospital as like a special library, in a sense, that these young startups don't have the tools they need, and they come inside, and the hospital is a smorgasbord of all the tools that they need to develop their innovation. And then on the fourth floor, you have the academic partners. These are major universities nearby, but they're also organizing fellowships in innovation and MBAs in healthcare innovation. So this is really the cutting edge. We developed a showcase of their innovations, so you can see what they're working on right now. If you go to thehealthhorizon.com/ARC right now, you can just see them. We've got all their innovations listed. They're organized by their strategic sector at the same time. Part of the large data model that it provides us is something like this. This is a quick visualization we did. So this shows the organizations in their immediate vicinity. So Sheba's there in the middle, and it has many, many innovations that it's spitting out in its idea lab. And then it brings in startups. Each of those is an organization, and they bring in an innovation with them. So that defines that second layer. Then you have the official strategic partners and academic partners. They have space inside the building. They're meeting the people in the idea lab all the time. They're meeting the startups all the time. They're helping out. Then the extra layer of analysis that our data system is able to do is what are all the evidence, what's all the evidence that's getting published, or the trials, what have you, by each of these innovations. Who else contributed to that evidence? And so that kind of network connection all of a sudden highlights the array of collaborators that Sheba themselves weren't even aware of. So with this kind of, the showcase, what we're trying to do is just make things much more transparent to everybody, and the data underlying it, we're trying to illuminate these connections that groups are often not even aware that they have. So that brings us to a close. This is probably a good time for Marisa to say something about the IHF's innovation project.
Thank you, Marcus and Matthew. So just before we move on, the IHF has the University Hospital Special Interest Group, which has been working on an innovation project. So joining us today is IHF's Knowledge Strategies Manager, Marisa Hilda-Petra, who will briefly talk about the group's initiative and also how IHF and Health Horizon will be working together. Marisa?
Yes, absolutely. Thank you all. Thank you, Matthew and Mark, and thank you, Patricia. So as Patricia said, I am from the International Hospital Federation, and I am just going to give you a brief pitch on what we do at the IHF, and in particular with the special interest group on the University Hospital, which is very much in connection with Health Horizon and on the innovation project. So there you have a nice family picture of the International Hospital Federation from last year's World Hospital Congress in Taipei. So the IHF, we are an international organization representing national hospitals and healthcare organizations from all over the world. And we have several objectives, namely fulfilling our vision to be a world leader in facilitating the exchange of strategic knowledge and experience in hospitals and in the healthcare delivery sector, of course. We try to bring the voice of all the hospitals and the healthcare industry, delivery industry, and decision makers in international organizations such as the World Hospital Organization and other major, including the OECD. We obviously are sharing their universal values for improved performance of healthcare services, better access to care for the population. And we do all this by providing our members with many opportunities for networking, amongst which, of course, this webinar, other sets of webinars, but also the annual Congress, the journal, website, and so on. Of course, the special interest groups are one of the many ways by which we help our members exchange and use our platform for networking, but also to focus on what are their needs and what are we going to put our resources on to help them overcome them. And one of them is, of course, the University Hospital Special Interest Group. So this UHSIG, as we call them, was formed in 2013 as a unique platform for peer-to-peer knowledge sharing among university hospitals on a global health scale. In 2014, this UHSIG completed its first global research with a first-of-a-kind study on international end-of-life care practices. Of course, this was the first project of the group. It was a great success, and this study is part in the 2016 Next Collaborative, as we like to call them, which was a study on the governance practices between university hospitals and aligned universities. Obviously, each of these collaboratives are then presented in our World Hospital Congress, and we by this, we try to engage with new members, potential members, and increase our platform for collaboratives. So after the Taipei 2017 World Hospital Congress, the UHSIG decided on the following collaborative, which is the innovation project. So what we realize is the university hospitals around the world are striving, but also driving, structuring, governing, and harnessing innovation to create value. So that it was key to identify different models implemented by them in order to lead educational institutions and medical training. With this innovation project, what we try to do, or the research we try to cover, is range from factors, and by determining mainly, so what is the role of the university versus what is the role of the hospital? We will try to examine the link between the educational centers and the industry, the corporate sector, of course, and try to describe all the market developments, like the impact on partnerships with startups, as we've seen with Shiba, and what are the resulting hybrid structures. The study intends to gather significant evidence from university hospitals worldwide in order to explain what is exactly disruptive innovation from their point of view, on how do they deal with it, and what is the impact of this innovation on the university hospital missions, which are mainly research, education, and care. So during this year, 2018, the UHSIG members have been narrowing down on different mechanisms to assess innovation process. So we've been elaborating the main guidelines, the framework, and of course the survey that we will pass on to all members, but not only, to collect a standardized set of basic information regarding governance of innovation. Then the IHF has already, well, we've already, of course, identified over 150 UH worldwide, and we'll be addressing the survey quite soon. Now, just a little parenthesis here, bracket, during the World Hospital Congress in Brisbane, we already had our UH members from various key university hospitals contributing with their case studies during the UH6 session. And we had University of Brussels, Hong Kong Authority, University Hospitals Geneva, and of course, Shiba, which was already treated by our colleagues from Health Horizon. In 2019, we therefore expect to get a vast collection of data from this survey and start our analysis of the responses. Then we hope to develop a tool or an instrument that would help us accompany as a secondary internet-based research on governance structures for innovation. And the idea is that we will present a preliminary set of results during the 43rd World Hospital Congress, which will be taking place in Oman in November. And then the year after, which will be the second phase of it, 2020, we will come up with all the conclusions and draft and catalog all the results in a sort of a manual of best practices to be presented during the 44th World Hospital Congress in Barcelona. So with this, what I encourage all our audience to come to us, to Health Horizon, of course, contributing and being joint partners with us in this innovation project. You can find my information in the slide, and you can also find, of course, Health Horizons. I'll pass on the hand now to Patricia and to Matthew and Mark, and we'll be happy to get feedback from all of you, and then maybe jointly collaborating in this so exciting innovation project. Thank you. That's all on my side.
Okay, so I might wrap that up here as well. So with what Marissa's just told us, we've created a channel on the Health Horizon called IHF, and we encourage any members here, if you can get your innovations together, you've got some great innovations you want to get up on the Health Horizon, then we encourage you to submit them on the IHF channel. And notwithstanding, any of your hospital groups can independently engage with us to build a channel of innovation for your hospital and hospital groups as well. And the collections that we make are available, to different audiences, to different memberships. But when any of the IHF members submit their innovations, they all come up and they can be found underneath the IHF channel, which is an important concept, that we can bring all these channels together under one umbrella, so that when people are looking for hospital innovations, that we can find them and discover them in different ways throughout the Health Horizon platform. So I think we're going to open up to questions now, and we just brought up a slide around the two concepts of getting innovations into your hospital and getting and spreading and getting your innovation out. So we're open to questions from any of the participants.
Thank you, Marcus. Can you please share your slide again so that everybody can see it on their screens? I'd like to remind everyone that you can start sending questions. Just click on the Q&A tab you will find in your Zoom webinar panel. Just type your question and we'll try to go through them in the remaining time that we have. All right.
Okay, is any slide back up? Sorry about that, we didn't realize the slides weren't up. So
perfect.
This was the preview that Marcus was talking about, where the channel of innovations within the International Hospital Federation that Marisa can refer to during the project. And please, that's my email address. Email me if you're interested in any aspect of what we do. We're really looking to do scans of entire countries, and we can. We're really happy to talk to anyone.
Yeah, so we're working with different hospital groups around the world as well. And obviously the work we've done with SHEEB is an example of what we can do for any hospital group.
Thanks, Matthew and Marcus. I have a question. So how many innovations do you see coming from hospitals through Health Horizon? How involved are hospitals in innovation? So
we've been scanning the sector for nearly 5 years now, and we started with a whole lot of innovations that had originally come out of hospitals. We reckon probably more than half the innovations involve hospitals in the healthcare sector, because the hospitals, whether the ideas originate within the hospitals or the hospitals are part of that innovation ecosystem as partners and collaborators, there's at least half of those. I mean, the digital health scene is exploding, and there are lots of startups and there's lots of groups coming out of really a kind of a startup philosophy, but invariably very quickly they all end up with hospital partners or some factor that a hospital contributes to it. So we've got about 4,000 in our catalogue, our public catalogue that's available. now. We've got tens of thousands of innovations that we have in our larger data set, which we curate. So it's important to remember that all of the innovations we look at have some form of evidence. They're evidence-led, so that even apps and things like that, they've all got to be on the path to having evidence supporting their innovation.
Maybe a good summary of that would be that we've noticed that hospitals are overrepresented in how they collaborate with innovations, but they're underrepresented in the innovations they have, and promoting them online.
Yeah, so we're trying to help them get visibility of their innovations themselves.
Great, thank you, Marcus and Matthew. I have here a question from Colin. Does hospital management need to set aside a budget that will foster or promote innovation in a hospital, from your point of view?
Absolutely. I mean, often hospitals have an office of commercialization, or they have, a medical trials unit, and they've got, head of research and things like that. But it's important to also make sure that you're casting a wide enough net and have a system for doing that. And often the budget itself is linked to the effectiveness of those innovations. There's an innovation dividend, if you will, from innovations that are being commercialized that goes back into a hospital budget. And this is part of Sheba's model, for example, where the hospital actually makes money from their innovation approach, such that they give some back to the hospital and they retain some. So the budget doesn't need to be large. And in fact, there's a whole lot of money for collaboration in many of the different countries of the world, because innovation is actually a whole movement that we see happening from governments around the world. And coupling innovation budgets with health budgets, health innovation budgets as well, is often a good way to share the cost. But notwithstanding, there are groups, innovation groups and investors that might actually be interested in putting money into your hospital to help you with your innovation. It's, these new collaboration models are quite exciting.
Thank you, Matthew. We have a question here from Sri Lanka. Can we be part of innovations team individually versus as part of the hospital group? Yes,
absolutely. So at the smallest end in our system are just individual innovations, and they can be promoted, they can be uploaded and promoted, they can be attached to a hospital, or they can just be established as a standalone innovation by themselves. And obviously with your contact details and details about the innovation, they can be followed and tracked by people who are interested in that innovation. And the whole concept around an innovation in our platform is that when you find it, you can follow it. And then when you progress, the people following your innovation will be notified of your progress. And that's often a trigger for them to say, oh, you've now gone into trials, or that you've received some funding, or that there's some new evidence. And they might want to then engage with you. So it's a really good way to really track progress and to gain a following.
Thank you, Marcus. Christine has a clarification. Did you say that the best contacts within hospitals to introduce new innovations is the Chief Information Officer?
No, often I mean, it can be if it's for information systems, for example, but often it's the Chief Medical Officer or indeed a Chief Innovation Officer if you do have one. There's a whole lot of different senior leadership positions that are involved in innovation, and that could be biotechnology chief, biotechnician, or could be the Chief Health Officer, for example, around public health innovation. So I'd be looking at any of the C-level people in the organisation and ask them about their innovation approach, their strategy, and what they're doing in terms of innovation. So I'd really engage with all of those in the absence of an actual overarching Chief Information Officer, a Chief Innovation Officer.
Thank you, Marcus. So everybody can still send in questions. Just type it in the Q&A tab, and we'll try to go through them with the remaining time that we have. I have a question because you mentioned Sheba earlier, and can you, just to give people the idea, how, if a hospital or a health facility would like to collate, they have numerous innovations that they want to feature, how can they go about this? How can they work with Health Horizon to do that?
So we'd encourage them to send us an email, do an introduction, and we can have a call with them to really understand where they're at in the innovation cycle. But the simplest thing is that, and we've done this with many hospitals, is that they point us towards some information they have around their innovations, and that we can put together an approach and to get them engaged with us. So it could be as simple as just putting some of the innovations they've got up, or indeed creating a channel for their hospital. So it's an important product that we've got, which is called a channel, and that is where you group your innovations together, and then that's something you can individually promote through your website or through your social media, and that way your senior executives, your clinicians, everyone within your organisation, within your hospital, can actually see the kinds of innovations. They can engage themselves, but you can also promote them to patients. You can promote them all around the world. So I'd encourage anyone to just get in contact with us, and there's a whole lot of different ways in which we could probably assist, but notwithstanding making sure that your innovations are visible, and that the minimum thing you want to do is to give any innovations a chance of commercialization or getting investment or anything like that, is to get them up on Health Horizon.
The other major activity that we've done in the past, we just completed a deep dive scan of Australia. That was a government-funded project where we detected and started tracking 1,000 innovations around Australia. That's all available. You can check that out, thehealthhorizon.com/AUS showcase. That'll take you there. And that's something we are talking with various nations to do. So at a governmental level, or a national level, I should say, doing scans of the entire country. And if you're interested in something like that, or you think that would be useful for your country, get in contact with us as well. A lot of conversations have started that way. Yep.
Thank you, Marcus and Matthew. We have a question from Chand. So he's a biomedical engineer, and his question is, if an innovation leads to a prototype device, what are your protocols for clinical trials, and what regulatory agencies approve the results of clinical trials?
Yeah, so biomedical devices is a hot area, and we love that one because it's some amazing innovations coming out of hospitals around that sector. So what we say is for something to appear on Health Horizon, a prototype is probably the minimum level of advancement that it needs to have. We do promote some breakthroughs because they have a public health interest, but around specifically devices biomedical, a prototype is adequate for it to be disclosed and for it to have a profile on Health Horizon. And then what we do is we look at, we don't necessarily assess which regulatory approvals it needs to go through to achieve its adoption. But what we do is we follow all the different evidence points and evaluation points to follow its progress. So you should put up anything that you have a prototype, because that could actually engage with a funder or even a group that's looking to invest in that particular sector or of that particular applied to a disease group or to a medical specialty. So getting the minimum up starts with you having a prototype, and you'd probably want to have some kind of IP protection around that as well. So the thing about Health Horizon is don't disclose it until you have adequate protection, but then we will follow its journey, and so will the people who are following it on Health Horizon, including funders and adopters and collaborators.
Thanks, Marcus. We have another question from Colin. You say that most of the disruptors to an industry will come from outside the respective industry, for example,
Yeah.
Uber, Airbnb, and so on. So which industry do you feel will disrupt hospitals?
That's a good question. I mean, the models of hospitals themselves is being disrupted, and the concept of hospitals in the home, but also patient centricity is what's disrupting digital health typically, and why digital health is being disrupting is because patients and engaged carers and others are demanding personalized technologies, personalized systems, personalized therapeutics. I don't think there's only one sector. I think there's an avalanche of new technologies. But I think the thing about all of these technologies is that when they start, and maybe they come from outside hospital setting and even outside of health, and not done by health practitioners, for example, but are being applied to health, they still need to engage with the primary and the tertiary health system. So this is really the opportunity of hospitals, rather than necessarily the disruption that's happening to hospitals. It's really the opportunity to engage so that hospitals are the ones that see the majority of patients. They are the ones that are in those settings that nobody else sees, and they've got pretty much the primary exclusive domain, which isn't going to change too quickly because of public health and because of funding and all kinds of things like that. So yes, it's disruptive, but I think the opportunity is bigger than the potential to be totally disrupted.
Thank you, Marcus. We have one question from Yvonne, because you've mentioned that you've had a project with the Australian government about featuring several innovations in Australia, and we've seen this at the World Hospital Congress in Brisbane. She's asking which hospitals in Australia have engaged with Health Horizon. I know there's plenty, so maybe you can just give some examples. And also she's asking which hospitals do you feel are leading the way in innovation?
Yeah, so a big one that we've been engaged with is Murdoch Children's Hospital in Melbourne. They're a big innovator. We've built a catalogue for them. We've got,
in fact, that one of the graphs earlier on in my presentation, the coloured circles and the relationships, that was an ecosystem graph of Murdoch Children's.
Yeah. But we've done a whole lot of others up in Queensland. We've got a lot of innovations from rural North Shore, like right across the country. Also institutes. So, hospitals and institutes. We've got, a whole lot of innovation catalogues built. But
there's Deb's HHSW stuff.
Yeah. So, yeah, I mean, you want to mention, we've got, some great innovations of things like antibiotic stewardship, which is a big theme running throughout the Australian healthcare system. So, Health Horizon is a member of the Australian Hospital Healthcare Association, as a member of IHF as well. So, we see a whole lot of, different settings, different innovations coming out. And it doesn't matter where we find the innovations. I think the issue is that they all, whether they're in a channel by themselves because we've engaged with the hospital, or the hospital has offered them up through one of its network partners, through the AHHA or through IHF or through others. It's important that those innovations get exposure. So we're pretty agnostic. We will also work with associations, disease associations and the like, and you'll find that they all come together with similar solutions and collaborations. I mean, most of them are collaborating together. This is what we find as well. So, but Murdoch Children's is great, and as is some of the Austin and all those great hospitals around Australia. There are some pretty substantial innovating hospitals.
But the reason we exist really is from an initial research grant from the Hospital and Health Services IP Limited. They're the group that does the commercialization for hospitals across 4 states of Australia, hospitals and health services. So, yeah, from the beginning, been focused on that.
Yeah. So commercialization of hospitals is something that I've been involved with for 10 years now, and particularly focused on how do you take these to market. And Health Horizon really is that kind of a marketplace, if you will, for those innovations, because it is very, by yourselves trying to commercialize every individual innovation is hard work, but in the innovation scene and the whole innovation movement is making that easier. And it's really about how do you do that? How do you get visibility? And that's why we developed the whole platform.
Thank you. Okay, we have one last question. Lots of talk about biomedical devices and information technology. Has Health Horizon listed new models of care?
Yes. So models of care is one of our sectors. We have a variety of sectors, and in fact too many to elaborate on. Whether it's so public health is one other big area. So models of care, systems of care, data systems, record systems. So soft technology is certainly a factor, and also public health campaigns. So we encourage any of those innovations in any of those areas. So, you've developed a new, sexual health management system in a regional healthcare setting. We want to know about that. So, or you've developed a new quality and safety system for, as I say, antibiotic stewardship. Any of those are innovations. It's not just the biomedical, it's not the hard innovations only. Other hospitals around the world are looking for solutions around all different settings.
And because it's so broad, it is hard to find everything. So please take us, hop on. You can just search Health Horizon. If you don't see some things, let us know, and we can start tracking those as well. Any suggestion you guys have really help us get the global coverage we're looking for.
Thank you, Marcus and Matthew, and thank you everyone who sent in their questions. If you think of any additional questions later on for Health Horizon, you can contact Marcus and Matthew through the details displayed on your screen. If you have any questions about the innovation project of the IHF University Hospital Special Interest Group, your registration email for this webinar has our details. Before we end the webinar, Marcus and Matthew, is there anything else that you want to say to our attendees?
Thanks very much for coming on. I mean, we're very excited by our work with the IHF and with you as members. We're doing some very some big things internationally. But we do see hospitals at the core of health innovation, and we really want to start filling in more of our catalogue, more of our data system with your innovations, because there is demand out there, and certainly if you're looking for innovations, you should be searching on Health Horizon as well. It's very simple, and I encourage you to do that.
Thank you again. We really appreciate the information you shared today, and we would also like to thank the attendees, everyone who signed in and joined us today. Now, it would be great to ask our attendees if you can answer our quick survey about the webinar. I will be sending the link on the chat box. Just quickly answer a few questions about the presentation today and all that. Just to remind also everyone, we will be posting the video recording on our website next week, and you will receive the link in your email. We hope you can join us again in our future webinars. The next one will be on the 13th of December. It will also be around innovation, specifically the work that the Geneva University Hospitals has been doing. So thanks again, everybody, and we hope you all have a great morning, afternoon, and evening ahead of you. Matthew and Marcus, thank you again.
Thanks.
Thank you.
Thank you.
Bye, everyone.